My name is Tessa Griffin, and the topic for my presentation is mental illness, prison, or treatment. The introduction to this block of information, due to the financial difficulties and grand budgets cuts of many states, were forced to close their mental health clinics and hospitals. The mental hospitals closed, and the patients, both long-term, short-term with no other options or places to go, ended up in other hospitals, on the streets, or in jail. The state of Georgia had hospitals that closed as well, one being Central State Prison in Milledgeville, Georgia. They stopped accepting patients in the year 2000 as the rest of their buildings were being vacated. With the advancement of the psychiatric medication, patients were able to be transferred to less restrictive facilities. During the evacuation of the buildings, 4 of those buildings were converted into prisons, one of which still remains on the property today. Another prison in Georgia that closed was Northwest Georgia Regional Hospital in Rome. They closed their doors in 2011 after a federal lawsuit determined that the state of Georgia was in violation of the Americans with Disabilities Act. In this settlement, the state of Georgia was tasked with relocating almost 10,000 mentally ill individuals, as well as individuals that had developmental disorders, back into the community. Upon being relocated, many of these individuals ended up on the streets homeless. Many came from poor communities where mental health services were either unaffordable or unavailable. Families did not understand their relatives' illnesses and didn't know what it took to manage those illnesses. Basically, a crime has to be committed for them to get treatment. According to the Department of Justice, nearly 1.3 million people with mental illnesses are incarcerated in state and federal jails and prisons. Georgia is among one of the 10 states with the least access to mental health care, and also has the highest rate of one of the highest rates of incarceration. In the state of Georgia, 1 out of every 6 offender has been diagnosed with some type of mental illness. Many offenders suffer from illnesses such as schizophrenia, bipolar disorders, and they are heavily medicated. Their access to treatment changes once they enter the prison system. Many lose some insurance benefits or government assistance they might have been receiving when they were on the streets. Treatment, if any, they were receiving before they were incarcerated is interrupted. And if they had a family or any type of support system, that support system is gone as well. As an approach to the management of mental illness, the Department of Corrections provides mental health services in their state prisons as well as probation detention centers. Georgia is approximately they spend approximately $6.5 million on psychotropic drugs alone. Augusta State Medical Prison, which is one of Georgia's facilities, it has 4 living units, and that is divided into 2 separate units. The facility has a special management unit. There's a 7-bed crisis stabilization center unit, as well as an acute care unit. Mental health services, mental health staff include administrators, support staff, psychiatrists, psychologists, counselors, nurses, as well as activity therapists. Many factors in prison, though, could also have a negative effect on an individual that's suffering from a mental illness. Such factors include the substandard facilities. The state of Georgia is in a financial crisis at the moment, and a lot of the buildings are old. They have faulty air conditioning. The overcrowding is greatly outweighing any of the other factors, as well as being among other offenders who may be predators. Some of these factors could affect an individual that is suffering from some type of mental illness. GDC does provide, though, in an effort to stabilize and rehabilitate their offenders. They provide different programs in order to assist with that stabilization. Mentally ill offenders are evaluated regularly during this rehabilitation process until it is determined that the illness is under control. Once the offender has served their time and paid their debt to society, he or she, it re-enters the community. The success of this reentry, though, is contingent on the mentally ill person continuing to take the medication as prescribed and seeking outside psychiatric services, as well as having a support system to make sure that these things take place. Upon being released, the department supplies these individuals with a limited amount of whatever medication they've been prescribed, as well as calling and making appointments at psychiatric facilities or with the psychiatric personnel staff in an area close to the area in which they live. Upon release, a number of individuals return to the same poor neighborhoods, to families that do not understand the importance of that individual continuing the medication as well as the psychiatric regimen that has been established. Failure to manage this illness results in the individual decompensating on the medication, committing a crime, and returning to jail all over again. The cycle repeats itself, but because of the inaccessibility of the proper mental health services that are available to these individuals.